Hello, everyone. My name is Jonathan Davis, and I'm one of the community liaisons for Health Alliance here in Central Illinois. I would like to welcome you to this year's brief overview of Medicare, Medicare Advantage, and understanding your care options. Now, I promise this is going to be a short overview, about 10 to 15 minutes. And in the meantime, I'll be giving you a beginner's look at Medicare and how it can be used in your life. So to begin, what is Medicare? Well, in short, Medicare is a federal health insurance program. It's a health plan managed by the federal government. During your working years, you paid into both Social Security and Medicare through payroll deductions. Now, these payments are in part the source of your Social Security and Medicare benefits today. On the screen, you can see an example of a Medicare insurance card. Medicare has different parts to it. These parts are referred to as parts A, B, D, and C. You can even add an additional coverage in the form of a Medicare supplement plan. We'll talk more about that later. Now, when choosing a Medicare plan, you have two main options. So what are these options? Let's look at option one. Option one is Original Medicare. Now, Original Medicare is made of parts A and B. It pays about 80% of your healthcare costs. And now it's important to note, it does not cover everything. Part A covers care if you are in the hospital, care if you're in the skilled nursing facility, and it also helps with some medical care at home. Your Part B, covers doctor's visits, ambulance services, physical therapy, and even other services as well. Most people do not have to pay a monthly premium or monthly bill for Part A, but Part B does have a monthly cost, and that's determined by your income. Again, it's important to note, Original Medicare only covers about 80% of your Medicare allowable expenses. Also, Original Medicare alone does not provide prescription drug coverage. So what about prescription drug coverage? Let's talk about that. That brings us to Part D. Simple, D for drugs. So prescription drug coverage is considered Part D. Medicare Part D is something you can add to Original Medicare. It's not sold by Medicare, but through private insurance companies. It's important to look into a Part D coverage. The reason being is without coverage, your prescription drug expenses can be quite high. There are some Medicare plans that do include a Part D, and we will talk about them a bit later. Now, there is even a lot more to know about Part D, but for today, it's important to note Original Medicare and even the Medicare supplement plans do not include Part D prescription drugs. So speaking of Medicare supplement plans, what are they? And how might they benefit you? The supplement plans is another add-on to Original Medicare, just like your prescription drug. There are several types of supplement plans offered, but not all of them are offered in every state. And remember, Original Medicare only covers about 80% of your medical expenses. So a supplement plan would help cover the remaining 20%. So just a quick overview of option one. It's basically Original Medicare. It includes Part A, your hospital coverage, Part B, your doctor coverage, both only paying about 80%. You can add a Part D, your drug coverage, and this will have an additional monthly premium. And in order to help with the remaining 20%, you can add a supplement plan as well. One other note about supplement plans, the premium or the cost per month, more than likely will increase every year you turn another year older. So what's next? Well, this brings us to option two. Now, option two is exciting. It's called Medicare Advantage or Part C. And the reason it's exciting is because Medicare Advantage plans are great. They combine all of option one, Original Medicare, into one plan. And in some cases, it'll even add that Part D or prescription drug plan. So you have your Part A, your hospital coverage. You have your Part B, your medical coverage. Your Part D, your prescription drug coverage. If that wasn't enough, Medicare Advantage plans offer extra perks like fitness plans, things that Original Medicare just doesn't offer. There are a few prerequisites to enroll in a Medicare Advantage plan. First of all, you must already be enrolled in Medicare Parts A and B. If you have enrolled in your employer plan or union plan, signing up for a Medicare Advantage plan could disenroll you. Medicare Advantage plans do have specific service areas, and you would have to live within that in your plan's area. You would still have to pay that Part B premium, everybody does, but there are other plans that may even offer a low or no cost premium. The great thing about this year or coming year, 2021, is that it used to be that if you had end-stage renal disease, you couldn't enroll in a Medicare Advantage plan. Well, that no longer is the case. End-stage renal disease is no longer a stopgap for not being able to enroll into Medicare Advantage plans. Things change all the time. Again, Medicare Advantage plans offer extras. If you see on the screen here, hearing aid and exam benefits, preventative care benefits, some dental coverage, and fitness benefits. It's important to note, Medicare, original Medicare, doesn't offer these things. So now we have had a quick overview of Medicare. The next question could be, where can you receive care with this type of coverage? Let's briefly discuss care options with Medicare. How does Medicare work with home care or home health, skilled nursing facilities, assisted living facilities, nursing home, and hospice care? Well, let's look at them one at a time. First, home care and home health care. Home care is considered unskilled, non-clinical care and is not covered by Medicare. Home health is considered clinical care and is covered by Medicare when prescribed by a doctor and is medically necessary. Moving on to skilled nursing facilities, also referred to as SNF. A skilled nursing facility refers to a facility that provides rehabilitation care to Medicare beneficiaries, you see, as a result of a short-term medical condition from which they are expected to recover. Skilled nursing facilities care is covered by Medicare Part A under certain conditions for a limited period of time. So what does that all mean? Well, one key to take away here is it's short-term. This is not a long-term care provision. There are many subtle rules and regulations involved in each skilled nursing situation, and it's best to always be prepared to pay for some or all your skilled nursing home care for any long-term situations. You may also get help with the cost, though, for skilled nursing facilities if you want to apply for services such as Medicaid. So moving on to assisted living. The cost of assisted living or long-term facilities are not covered by Medicare. However, when you're in a facility like that, some qualified healthcare costs could be covered by Medicare. Again, details we can go over if you want to have time to sit down with me or any other person that may advise you on these things. How about nursing homes? Most nursing home care is not covered by Medicare since it is mainly non-clinical. Care like with bathing and dressing. So again, a long-term situation not covered by Medicare. To wrap up the care options, let's look at hospice care. Hospice care is typically considered end-of-life care when a patient is expected to live 6 months or less. Care can be provided in the home, at a hospice center, in a hospital, or even the skilled nursing facility. It's important to note that Medicare does cover hospice care through Medicare Part A, but the hospice provider must be Medicare contracted. One positive note about hospice care is that occasionally you can come off of it if you recover or your situation changes. So what time of year can you enroll in a Medicare or Medicare Advantage plan? Let's take a quick look at that. There are actually several time periods when you are able to enroll into Medicare. I'll be happy to go over all of these in detail with you at a later date. But for the sake of today's presentation, I would like to point out the next opportunity most will have to enroll in a Medicare plan. And that is the AEP, or also known as the annual enrollment period. Between October 15th and December 7th every year, those who qualify can either enroll in a new plan or change their current plan. So you'll never be stuck with one plan. Your insurance can adapt to your changes in lifestyle and needs. So I promise you, this is a quick overview. To qualify for Medicare, you need to be age 65 or on disability for more than 24 months. I'd be happy to set up a time to answer any questions you may have, and I can be reached by email at jonathan.davis@healthalliance.org, or you can give me a call at 217-902-8153. Health Alliance offers education webinars and events like this one each month to further keep you informed on all things Medicare. This time of year with the AEP season in full effect, I guess you would say. Again, if you have any questions on Complete or Medicare plans the Health Alliance offers, or you just want general basic information, please reach out to us. Again, you can find out more about our webinars at healthalliance.org, or you can go to medicare.healthalliance.org/events. Thank you so much for the time you give me today to talk to you about these things briefly, and I look forward to hearing from you all. Thank you.